What's your reaction to hearing the news today?
Well, it sounds that she was either enrolled or had a really good physician and had some screening done, which probably found her malignancy. We don't know. They're being very private, as I would expect for this, unless she had some symptoms. But they found it at an early stage, which is important for many cancers to find them so that they can be treated prior to spreading throughout the body.
Okay, so what does this raise for you in terms of your particular role, radiology, and the importance of screening?
So many specialists, including radiologists, take part in screening programs that are given through the BC Cancer Agency. There are four that I know of that we often actively take part of. And one is breast cancer screening. There's lung cancer screening. There also is what we call GI, or large bowel screening. And there's also cervical screening. So often we see these patients come through. Sometimes when the physician can't use an endoscope to see. Sometimes they just can't navigate the curves of the bowel, as I could say, or sometimes it's just the person's too frail or they can't tolerate the pre-treatment for it. So sometimes we do that. But imaging is often the first modality for screening for lung and breast cancer in particular. So we are the first line people that they come to. So people that are at high risk for these cancers often come to see the radiologist first.
I see. Well, what kinds of conversations should people be having with their doctors?
Routine discussions to see if they are at risk for certain malignancies. Um, Sometimes with breast cancer, I still say the most common breast cancer I see is somebody that doesn't have a history of breast cancer. But we know that in people, especially if you've had a first degree relative with breast cancer at a young age, that probably should start screening at least 10 years before the age that they were diagnosed.
I see. Now, I know that you've been a guest on CBC in the past. You've told us that some patients have had to wait up to 6 months for some appointments. So even if you're, thinking about getting screened, that type of thing, what are the reasons behind the wait times right now?
Medical imaging is at an all-time crisis. It's a lack of resources, it's a lack of personnel. And it's just come all together with the post-pandemic backlogs, increasing ages of the population. So there's many factors that are resulting in these delays.